Now we'll quickly try to move to the next artery of the upper limb, which we'll get to discuss its anatomy. And this is the subclavian artery, and you can see that alongside the subclavian artery we have the subclavian vein. Okay, subclavian artery. Let's spot it again. You see that it is labeled subclavian artery. So looking at this, we see that it's a paired major artery of the thorax, and it supplies blood to the upper limb, the neck, and the thoracic region or wall, and the brain. Okay, so we see that the right one actually arises from the brachiocephalic trunk. Okay, while the left one, you can see that there's a different arrangement on the left. So right one is the terminal branch of the brachiocephalic trunk, while the left one is the third branch of the aortic arch. So you see that the arch, it arches laterally over the first rib, divides into three parts. Okay, we've spoken about those parts. Three parts is just before the anterior scalene muscle, while the second part is under the anterior scalene muscle. The third part is where it will now continue as the axillary artery. So major branches in the first part, we have the vertebral artery, we have the internal thoracic artery, we have the thyrocervical trunk. Second part, we have the costocervical trunk. Alright, then third part usually have muscular branches. So it supplies the upper limb, supplies the posterior brain and the cerebellum. It gives some branches that goes to the brain. Supplies the neck and the thyroid gland. Supplies the thoracic wall and the breast. Also the posterior intercostal spaces and the cervical muscles. Beautiful.